Hello, my name is Dr. Saxena, and I'm the Chief Medical Officer for our Forum Health Network. On behalf of all of our providers, we're excited to be able to share some more information about low-dose naltrexone. This is one of the most effective and well-used compounded prescriptions, and for good reason. See, in a functional and integrative medicine approach, we're always looking for the root causes of issues, and it's no different for people who might be suffering from long-haul COVID syndrome. So low-dose naltrexone, which is sometimes called LDN for short, is a key player in helping us help patients. Let's explain a little bit more. First, you'll notice it says low-dose naltrexone. Naltrexone by itself in regular dose is an FDA-approved medication. At 50 milligrams, it's used to help people who may be suffering from alcohol or pain medication dependence. But at a much lower dose, over 90% lower dose, around 1 to 4.5 milligrams, we find that naltrexone has a whole different effect on the body. And what we've learned through the use of it for decades is that this medication that's approved for safety by the FDA at 50 milligrams, when used at a low dose, acts as a potent anti-inflammatory signal and starts to balance the immune system from whatever threw it off. So let's try to understand the mechanism a bit more. Original design is what I call how our bodies were originally designed to work. So whether it's through nature or God, it seems that deep sleep is something important for us. And what determines if we go into deep sleep? Well, if we have mostly a good day physically and psychologically, the brain is surveying the outside world and what's happening inside the body. And if it says, hey, we had a good day, it tells the immune system to rest. How does it do that? It goes into deep sleep. And the way that it calls out to the immune system is that it releases some endorphins and enkephalins, what I'm going to kind of cutely call the happy squirt. Now, this little happy squirt of endorphins and enkephalins signals to the immune system to go to bed, basically saying it's all good out here. So if the immune system is allowed to go to sleep and regenerate and heal, then what you'll find is that you'll have an immune system that's strong and tolerant. Tolerant meaning non-irritable, non-confused. You probably know this, but stress is almost a given in the modern era. So when that brain is overseeing what's happening on the inside of your body or outside in the world, many times it's going to pick up on psychological distress. So things that might make you worried, anxious, angry. And it can also call something eustress, which means, hey, this is exciting. I just got a new job, but it is kind of stressful to really anticipate all the things that are going to happen with this promotion. So if the brain sees stress, whether it's negative or positive psychologically, or it sees stress in the external world or inside your body, in the physical world, it's going to, guess what? It's going to not allow the happy squirt to occur. The brain is basically saying, guess what? It's dangerous. It's a bad day. Immune system, I don't want you to go to sleep. I want you to stay up all night with me. I don't want you to go into deep sleep because we got to be on alert. And so if this happens day after day after day, you can kind of imagine that the immune system starts to get weak and confused over time. And this is a poor setup. So here's the beautiful thing about low-dose naltrexone. What it basically does is it's an insurance policy that the happy squirt comes out at night, no matter what your day was. So what it basically does is tells the brain, hey, it wasn't so bad. We had a good day. So tell that immune system to go to rest. So when the LDN at a very low dose creates that release of endorphins and enkephalins that's physiologic, meaning it's the normal original design of the body to release that happy squirt, then guess what? The immune system goes to bed and wakes up stronger and more tolerant day after day after day. Now, why would we want an immune system that's strong and tolerant? Well, as the case is with long-haul COVID syndrome, We want it to be strong because we want it to be able to identify any germs, viruses, bacteria, parasites, yeast that may be in our system that we need to strengthen the immune system so we can attack it appropriately. As a side note, low-dose naltrexone is commonly used to help support anti-cancer signals because it's the same immune system that identifies and attacks cancer cells. So low-dose naltrexone has that added benefit. Now, the other reason we like low-dose naltrexone is because it makes the immune system tolerant. That means it's not so irritable and inflamed. And inflammation is the root cause for so many people's brain fog or just this fatigue and malaise that's associated with long-haul COVID. The other thing is that when the immune system is intolerant, it becomes confused and starts to attack your own body. That's called autoimmune dysfunction. So if you have an existing autoimmune issue or you had a propensity towards something autoimmune, what low-dose naltrexone will do by way of the happy squirt is get your immune system to rest so that when it's waking up, it's not going to be confused and create a bunch of inflammation and confusion where it's attacking you by accident. So LDN, what you can expect operationally when this is prescribed to you is that we send the prescription to a compounding pharmacy, one that can take regular dose naltrexone and make it into the much smaller dose that we need it. You'll see that we'll start at a low dose and work yourself up to the dose that is our ideal target goal for you. Now, the other thing to know, the only side effect for low-dose naltrexone is vivid dreams. Now, I don't even call this a side effect because it's what happens when you go into deep sleep, and that's supposed to be a good thing. 95% of people do just fine with this side effect, and most don't have it. If they do, it lasts for a few weeks and goes away. If it's something that really is bothering you, you can portal message your provider, and there may be an adjustment in the dose or when you take your medication. This is typically taken at bedtime. The one caveat is, if you remember, naltrexone full dose is used to help people who might be dependent on narcotics, things like codeine and morphine and some of those hardcore pain meds. It is not a problem to take LDN if you need a pain medicine like ibuprofen or acetaminophen, which you may know as Tylenol. So if you are on a narcotic, please be sure to tell your provider. Also, if let's just say while you're on this medication, there's a need for surgery, it's okay. We can wean you off the low-dose naltrexone. You can get the surgery done, take your pain meds, and then we can titrate you back on. So just stay in communication. So there you go. That's the information on low-dose naltrexone, why we think it's such a potent pharmaceutical, but really helping us reestablish original design. It's essential for so many people who are suffering from the effects of long COVID or long haul COVID. We look forward to being a partner with you, and please be sure to communicate to your office staff if you have any questions about this medication.